This week marks 5 months since the first diagnosed case of COVID-19 in Australia, and that's been a hard 5 months for the nation. We've done well though, and avoided what could have been thousands of deaths. Outside of New South Wales and Victoria, there's probably no circulating virus. But despite Victoria having had some of the toughest restrictions and doing masses of testing, there have been repeated community outbreaks with stubbornly high numbers over recent days.
Since April, we have got half of all of our new cases have come from family to family transmission. And I'm frustrated by it, I'm disappointed by it.
We know much more now than we did in January about how the COVID-19 virus transmits. Outdoor spread is not common, especially if people are wearing masks. The coronavirus takes off indoors and in clusters, especially with prolonged contact. Home is where the risk is greatest.
It is unacceptable that families anywhere in our state can, just because they want this to be over, pretend that it is. It is not over.
Professor Mary Louise McCall is an advisor to the World Health Organization on COVID-19.
The Australian people have partnered very well with the government to date. Every population gets fatigued. They do consider that they're not at risk, and they also get a bit tired of complying according to social distancing.
So we have 16 new cases of coronavirus in Victoria over the last 24 hours. We have 125 active cases in Victoria.
Look, I think there are three things that are happening in Victoria. One is a community outbreak, and that's quite complex. And I think that it's about 28%. And they're family clusters, but equally there's about 21% that are related to travellers coming back and their risks that they pose onto staff at quarantine hotels. And then there's health provision, and that's about another 14%.
These new cases include staff who've worked in hotel quarantine, someone who attended the Black Lives Matter protest who spread it in an H&M store, family clusters, and an infected general practitioner.
A GP got sick on the 15th of June. There were 5 linked to the GP, then another 2. Then Monash Health, there was another 2 cases, and so forth.
Professor James McCall from the University of Melbourne sits on the National Health Advisory Committee on COVID-19.
An important thing to remember about the Victorian cases at the moment is we still have very few cases. Of course, what matters is how quickly it's growing as well, and it does look like it could be growing quickly.
The National Advisory Committee has not recommended the wearing of masks, despite growing evidence that they do reduce spread, especially indoors, when social distancing is hard.
If you're going to loosen up social restrictions, you need to wear a mask, because Melbourne is a sobering reminder that the numbers are not abating.
In situations where it is unavoidable to have closer contact, that wearing a mask may be appropriate. We have continued to recommend against widespread use of masks because of the concern that people may take more risks because of thinking the masks could do more than they can.
The question is, why is Victoria seeing this and not, say, New South Wales?
It's a good question. I think part of it is just down to luck. I mean, Victoria and New South Wales have always had the most cases, driven by our strongest links to international arrivals. A few people who get it transmit it to a large number of people. And so you just expect large fluctuations. A few months ago it was New South Wales, now it's Victoria.
This pandemic has a long way to run, and there's no room for complacency or self-satisfaction.
We've been conducting surveys with the government over the last many months, which indicates that somewhere around 3/4 of the population are starting to no longer realise that they need to be aware of the risks, and that's a cause for concern.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.